Understanding Type 1 Diabetes. What is Type 1 diabetes? Type 1 diabetes is a long-term condition that affects how your body uses insulin, a hormone produced by the pancreas. Insulin is crucial because it helps move glucose, a type of sugar from the foods we eat, into your cells to be used for energy. Without enough insulin, glucose builds up in the blood, which can lead to health problems over time. Who does it affect? Type 1 diabetes typically begins in childhood or young adulthood, but it can develop at any age. Today, around 82% of people with type 1 diabetes are over 20 years old. In many regions, it represents 5 to 10% of all diabetes cases. Who gets type 1 diabetes? Type 1 diabetes occurs when the immune system mistakenly attacks and destroys the beta cells in the pancreas that produce insulin. This is known as an autoimmune response. Unfortunately, this process can take months or years and generally results in noticeable symptoms only after over 90% of the insulin-producing cells have been damaged. While having a family history of type 1 diabetes can increase the risk, it can also arise in individuals without any family history of the disease. Genetic factors may contribute to the risk, and certain environmental triggers like specific viruses are under investigation. For those closely related to someone with type 1 diabetes, the risk of developing the condition is higher, 5 to 6% compared to 0.4% for those without any family history. There are tests to identify if family members are at risk, particularly looking for pancreatic autoantibodies in the blood. Diagnosing type 1. Diabetes typically involves noting symptoms and conducting blood tests. Common symptoms of high blood sugar include excessive thirst, frequent urination, fatigue, blurry vision, increased hunger, and unintentional weight loss. In some cases, people may experience diabetic ketoacidosis, a serious condition that requires immediate medical attention. Symptoms of DKA include nausea, vomiting, rapid breathing, and extreme drowsiness. Blood tests help confirm the diagnosis of diabetes. If diabetes develops before adulthood, healthcare providers usually identify it as type 1 diabetes. For adults, further testing might be necessary to distinguish between type 1 and type 2 diabetes. Managing type 1 diabetes involves a team effort, including you, your family, and healthcare providers, such as doctors and diabetes educators. Treatment plans often include regular blood sugar monitoring, insulin therapy, injections or an insulin pump, healthy eating, and regular exercise. Preventing complications is key. Keeping your blood sugar levels stable can significantly reduce the risk of long-term complications, including problems with the eyes, kidneys, and nerves. To manage your condition effectively, monitor your blood sugar levels multiple times a day, or use a continuous glucose monitoring device. Attend regular checkups with your healthcare team. Have eye exams and maintain good foot care. People with type 1 diabetes are also at a higher risk for cardiovascular issues. To lower this risk, quit smoking and get help if needed. Manage blood pressure and cholesterol through changes in diet, regular exercise, and medications. Maintain blood sugar control by keeping your A1C levels below 7%. Consider daily aspirin for some adults, especially those with cardiovascular risks. Living with type 1 diabetes requires a proactive approach, but many people successfully lead full and active lives. With appropriate care, education, and support, you can navigate the challenges and enjoy your daily experiences. Remember, you're not alone, and plenty of resources and communities can help you along the way.